Second oral question, Lord Scriven.
My Lords, I beg leave to ask the question standing in my name, and in so doing I draw the House's attention to my interests as laid out in the register.
We recognise that waiting times can impact outcomes, so patients in queues remain under constant clinical supervision and care and are prioritised according to need. Delays tend to be concentrated in a small number of hospitals, with 29 acute trusts across 35 sites, responsible for 57% of the 60-minute handover delays nationally so far this winter. These trusts are receiving intensive support to improve, including through placement of hospital ambulance liaison officers and the safe cohorting of patients.
My Lords, 500,000 acute bed days each year are lost due to delays in discharge, directly attributable to non-availability of social care, which leads to bottlenecks in emergency departments and ambulances being unable to unload patients. So does the Minister agree that the split of money raised by the Health and Social Care Levy over the next 3 years therefore needs to be more generous to social care so people stop having to wait up to 7 hours in the back of ambulances?
Well, as an Overlord will be aware that when the charge was initially announced, it was intended to help with social care, which has been neglected for a number of years under successive governments. Given the pressures on the backlog in the NHS, we've decided to divert some of those resources to help tackle the backlog. But we've invested money in social care, both for the short-term winter plan, but also in the longer term we've announced extra investment to make sure that social care is an attractive career and offers real prospects.
Does the Minister recognise, though, that his response saying that this is a small number of trusts doesn't address the data that comes from NHS England for the 7 days to January the 2nd, which showed that 23% of all arrivals by ambulance had delays of half an hour or more. That's over 19,000, and some 10% of patients waited more than an hour to be handed over, meaning that those ambulances were also not able to go and deliver first aid and first implementation of treatment to people who were waiting, therefore meaning that when patients arrived at emergency departments, they were even sicker than was necessary, and it may be that some lives were lost.
Well, the Noble Baroness makes an important point, and in anticipation of the winter crisis in last year, we published the Urgent and Emergency Care Recovery 10-point action plan, not only to look at the pressures directly on A&E, but also on the call centres, but in addition to look at some of the wider system issues. For example, when people can't get access to their doctor, they tend to go to A&E. Other times they can't get the medication they want. They can't get a replacement medication. They actually have to call an ambulance to go into A&E to get that medication. So we're looking at some of the wider system problems to make sure that we address the backlog.
NHS workers on the front line have been warning for months and months that the service is under strain due to a combination of waning workforce, COVID, respiratory infections, backlog of patients and build-up of health problems through lockdowns. And the Royal College of Emergency Medicine has been calling for months for a response from ministers to deal with short and long-term solutions. We indeed called on the Health Secretary last summer for urgent additional support to be put in place. So why are we still waiting for that leadership and necessary support to materialise?
Well, I'm sure the Noble Baroness will acknowledge that a number of people have been calling for ways to address this. And the government announced last year, at the end of last year, the Urgent Emergency Care Recovery 10-point action plan. That includes supporting 999 and 111 services, looking at primary care services and community health services, greater use of urgent treatment centres, increased support for children and young people, better communications and call handling, improving inflow and hospital discharge, looking at mental health needs and a number of other issues. And in each of those 10 points, we have drilled down, working with Trust and with the ambulance service to make sure that we can address the issues that are currently raised.
Lords, could the government look at how many lives have been lost as a result of delays? I suggest this might be more of an issue than government's aware of.
Regularly talks to the NHS and particularly every day, in fact, and we have, for example, daily Omicron calls But if we look at some of the data, over 925,999 calls were answered by the ambulance service in December 2021, or nearly 30,000 calls a day. That's 2% more than November 21, 22% than in November 2020, and 9% more than in December 2019. What we've done is invest in more people in the call rooms, working with BT to better handle the calls, but also making sure that we've got more staff where we need to have staff to handle that, the whole system, to make sure that we can respond quicker.
My Lords, Baroness Brinton wishes to speak virtually. I think this is a convenient point for me to call her.
My Lords, yesterday NHS England data showed that trolley waits of more than 12 hours in A&E rose in December to just under 11,000, which is 3 times higher than in December 2020. One hospital reported it had a dozen patients waiting on a trolley for a bed for over 24 hours. The Minister has talked about extra money, but without staff and bed capacity both in hospitals and care homes, the crisis remains. Can the Minister please say what the government is doing right now to help alleviate the current crisis?
Well, I thank the Noble Baroness for giving me this opportunity to say what the government is doing right now. We are working closely with the ambulance service, with NHS England, and also the Association of Ambulance Chief Executives and Services to reduce the handover delays. The 10-point plan that I announced earlier on, or re-announced, I might actually announce it, but I referred to, goes into real detail about how we handle this, both at the level of the call centres in handling the calls. Sometimes some of those calls are not emergencies, for example, and the patients are directed elsewhere, but also in terms of making sure that the wider system is available to make sure that patients are unloaded within the 15 minutes of the target, but also to make sure that the ambulances are turned around as quickly as possible. Where we've spotted disproportionate pressures in the system, as in the 27 hospital trusts across 35 sites, we focused more resources there.
To my noble friend, I appreciate that he has to read out what he has in his brief, but would my noble friend just take time to read the report on social care by the Economic Affairs Committee of this House, which received pretty well universal endorsement, and then will he discuss with his colleagues where we really have fixed social care and whether the resources which he is claiming are sufficient to meet the problem.
Well, I thank my noble friend for drawing my attention to the report and the work of that committee in particular. And I will commit to reading the report, and I look forward to future discussions with my noble friend and indeed many noble lords across the House.
Would it be possible also at this time to talk about preventing the next crisis and the crisis after that? Because are we not always chasing something? And the fact that the NHS, which does not spend a large amount of money on prevention, is now being hoisted by its own petard.
Noble Lord raised a very important point, and one of the things that the NHS is looking at in more detail, and some of the issues that we will be discussing in the debate on the forthcoming Health and Social Care Bill, which is how do we move a system culturally, not only to treating patients once they're ill or need treatment, but also how do we work in terms of prevention? How do we encourage healthier lifestyles? How do we make sure that sometimes when patients are kept too long in hospital, that they lose lose certain facilities or muscular, etc. So how do we look at prevention as opposed to just treatment and getting that right balance is something that the NHS and the Department of Health are looking at closely.
As a result of COVID's impact, many A&E departments have reconfigured their internal infrastructure and their working practices. Could the Minister tell the House how is best practice being disseminated to other NHS trusts, and what support, financial and otherwise, have trusts received to do this?
Well, given that it was identified that there were particular pressures on 29 trusts across 35 sites, extra resources have been targeted, and teams have gone in on-site visits to work out the flows, for example, in those hospitals, and to make sure they don't only deal with the immediate issues that those departments face, but also the wider system issues. For example, as I've mentioned, sometimes patients can't get hold of doctors, and therefore they go to A&E as a substitute because they want a face-to-face appointment. We're looking at a number of those wider issues. We announced 55 million winter funding for all ambulance services. We've boosted staff numbers by 700, including availability of the ambulance fleet, through £4.2 million investment to improve investment times. We've also invested another nearly £2 million to support the well-being of frontline staff during these pressures, because they've had increased pressures. We must make sure we look after our staff as well.
Is there a breakdown on the difference between physical resources in hospitals and the shortage of staff?
I'm not sure. I'm not sure if there is a breakdown. And indeed, as my noble friend said, sometimes I do have to read out what's in the back. Sometimes I freelance, as I'm sure many will appreciate, or maybe not appreciate. Indeed, if I divert from the government line. But I will endeavour to find out whether those stats are available.